When she was diagnosed with breast cancer, she didn't slow down, she got moving. Why doctors say that had everything to do with her protecting her heart during her treatments. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. The patient you're about to meet says she will never forget the way her doctor looked at her when she was diagnosed with breast cancer. The cancer was growing quickly, but Angela was quicker. As Janine Kiesling shows us, Angela turned to fitness to help her survive.
He goes, you have just blossomed. It reminds me of a monarch butterfly.
1 month after she finished her cancer treatment in April of 2014, a personalized bra was made for 37-year-old Angela Candiano so she could strut her stuff in this monarch butterfly bra at Art Bra KC, a fundraiser for breast cancer.
I just had a gut feeling like something was wrong.
Angela was coming off a grueling year-long battle with breast cancer.
The doctor came in and she said, I need you to sit down. You sit down a minute. And she said, I'm looking at your films from when you were here 9 months ago. And she said, it looks like I am looking at a completely different person.
In 9 months since Angela's last mammogram and sonogram, 5 cancerous tumors had developed. Her doctor told her to find an oncologist immediately.
Everybody said the same name, Dr. Fabian at KU. She got me in right away. And they were starting chemotherapy that following Thursday. So it wasn't even a week.
Angela had stage 3 breast cancer, and it was aggressive. She had weekly chemotherapy treatments for a year, followed by radiation and a double mastectomy. Angela stayed positive throughout the process, but knew the odds were against her. Instead of taking it easy, Angela hit the gym.
I think looking back now, it helped me feel strong. It helped me feel like I had control over something.
Angela beat her cancer and wants to help others facing breast cancer diagnoses. She's getting certified to be a personal trainer and has plans to start a not-for-profit to help others battling breast cancer through fitness.
My ultimate goal is to be able to provide them with a path for them to feel more confident about themselves, for them to feel healthy, for them to get strong.
Exactly 1 year after Angela woke up from her reconstruction surgery, she entered her first fitness competition. And guess what?
It went great. I won.
Well, I'd say that's a pretty good start. You won. We are thrilled to have Angela in the studio with us today. And Angela, right out of the gate, congratulations are in order because you have a new last name.
I do.
You're no longer Candiano, you're Van Zandt.
Van Zandt, yes.
You are such a gorgeous bride.
Oh, thank you so much.
Tell us a little bit about the guy you married.
So his name is Larry, and he is absolutely amazing. He is my rock, my best friend, and I truly have found my soulmate. I really have. He is just the best I could have ever dreamt for.
Congratulations,
thank you.
Angela.
Thank you.
We are also joined by 3 members that were crucial members of Angela's care team. We're joined by cardio oncologist Dr. Charlie Porter. Thank you for being here. Pleasure. Angela's gynecologic oncologist, Dr. Andrea Jewell. Thanks for making time. And Dr. Carol Fabian. Dr. Carol Fabian was Angela's breast medical oncologist. Thank you all for making time. Angela, what's the status of your cancer today?
So today I am in full remission and everything looks good. There actually has been a couple scares over the past months, but we are very hopeful that everything will be fine. I have another test that's coming up. Actually this Saturday I have an MRI. And then I will be meeting with doctors to kind of look at that to see if everything is okay. And if it isn't, then I know I am in the right place with the doctors here at KU.
You're just marching ahead and so successful. When we last had you on the program, you were working on getting your personal trainer certificate. What's the status on that?
So I have that. I have that now, and it is amazing because it's like the first step to begin the nonprofit. So yeah,
we're going to get to the status of the nonprofit in a little bit. I want to talk to Dr. Fabian for a minute. Dr. Fabian, Angela had 5 cancerous tumors in her breast. You met her just days after her diagnosis. Can you explain how aggressive is stage 3 breast cancer?
There's factors associated with the tumor itself that makes it aggressive, and then there's factors that associate with how far the tumor is spread. So when we talk about stage 3, we're talking about tumors that are either 5 centimeters or greater in diameter, or about 3 inches, or which are large and have also spread to the lymph nodes. So that was Angela's situation. But in addition to the amount of spread the tumor exhibited, it also had rather aggressive features in that it had growth factors on the surface called HER2 proteins. And it had receptors for hormones on the surface called estrogen and progesterone receptor. And only about 10% of breast cancers have all 3 receptors on the surface, and that's called triple positive. Hormone receptor positive, like estrogen and progesterone, as well as HER2 positive. And that is one of the most aggressive tumors. Luckily, it's very responsive to chemotherapy, targeted therapy with Herceptin, and anti-hormone therapy.
Angela, what's so jarring as a person listening to this is you had had a mammogram just 9 months prior?
I had.
And it didn't, this wasn't happening 9 months earlier.
No, it was not. It was not. I found a little cyst, like a little knot, and they said that, that it was a cyst. This was through another doctor, and went and had, the mammogram and the ultrasound, and, that's what they said. Oh, it's just a cyst. It's nothing, And then 9 months later, I found another bigger knot on my right breast, and I was like, oh my goodness. And so that is when I was sent again, to have another MRI and, mammogram, and that is when it was discovered. So
that's why it's so important to get checked every year.
Absolutely, absolutely.
Now, Dr. Jewell and Dr. Porter, I'm going to get to you in a minute. Dr. Jewell, you are a gynecologic oncologist. So Angela became your cancer patient after the medicine used to treat her breast cancer left her with precancerous cells on her uterus. I want to share an image, a pelvic ultrasound that you shared for us. What are we looking at here?
Ultrasounds are always kind of hard to look at, but what we're seeing here is a side view of her uterus, and the brighter white area in the center, that is the lining of her uterus. And so that is something that should be thinner than what we're seeing here. And so I very commonly meet breast cancer patients when they're on maintenance therapy if they have irregular bleeding, or if we get an ultrasound and we see what we see here, that like thickening in the middle, because we know that that is not always cancer or precancerous, but we know that they are at risk of that. And so they need to be evaluated by a gynecologist. And a lot of times here at KU, we would evaluate with a GYN oncologist because we work in tandem with the breast doctors.
So this is something very common.
It is, it is. So it is not common that these patients develop cancer or precancerous cells. So that is not common. So I don't want to make patients afraid of taking maintenance therapies. Also, Angela can attest to the fact that we saw each other very frequently.
Yes, we did.
And we had many biopsies that were very normal before this became something precancerous. And we kind of reached a place where and this happens with other breast patients, ultrasounds, biopsies, you're doing this every few months. A lot of women say, I think I just want a hysterectomy. Like these are invasive, not super invasive, but they're procedures. And that's kind of where we had landed, and we said, well, these changes just keep persisting, so we should consider a hysterectomy. And it's good that we did because we found precancerous cells.
Right.
Now I want to get to Dr. Charlie Porter, because Dr. Porter, you're a cardio-oncologist. And this comes in because often breast cancer treatments can have effects on the heart. At what point did you meet Angela?
I met her at the early phase when she was starting one of these targeted treatments, which was a breakthrough, one of the first targeted treatments. Now there are hundreds of applications for these drugs, but in 2005, Herceptin blew up as a very positive early stage breast cancer treatment, and it kind of led the way. It was the tip of the spear. And we know early on there was like 15 to 25% incidence of weakening of the heart, but that was when adriamycin, Red Devil, was used concurrently with or just before the Herceptin. But there's about 5% of people who have some declines, and we do surveillance echoes every 3 months across the board. Not everyone needs it that much, but it's hard to know who not to study. But Carol was actually my first, Carol introduced me to cardio-oncology after there was this big series of papers in 2005. I called her up. She had been I met her when she was a junior attending and I was a senior resident. We were not very far hierarchically. She was at the bottom of the faculty totem pole and I was at the top of the trainees. So we were kind of good, and Carol always walked around. She wore 4-inch heels on 12 hours of rounds. I mean,
you're calling her Carol. We call her Dr. Fabian, just to bring our audience back.
Yeah.
So I love hearing this about Dr. Fabian, though.
Well, so she was kind of a amazing little force of nature back then, and so she said, okay. I called her and said, you're going to have some trouble with some of these patients. She said, okay, I'll call you. You're on. So she just basically we just launched the cardio-oncology program by phone one day when I read those papers. So and this was 2012 or so I was 5 years into that experience. But exercise is really a key component for feeling better and staying with the program. She had multiple drugs. Nobody feels better on the chemo, and it depends, but the exercise is the most important thing that patients have control over. Because you're helpless. You've got this schedule of appointments. Your life's taken over. No cruise, no nothing. You're here. If you can get a boat to KU, then you can call that a cruise. But they're here. So the exercise is one thing, and she did it on her own. Basically, got started to say, I'm going to take control of my life. I am going to do something to help myself, and it's exercise. And over the past several years, there have been more and more studies that show actually people who exercise, and the higher the dose of exercise, the more likely it is that there will be favorable changes in the heart function that are not as significant as those who sit during treatment with the Herceptin. So she was treating her heart herself with exercise, kind of on her own.
That's amazing. So, Dr. Fabian, do you always refer your breast cancer patients to a cardio-oncologist, to Dr. Porter? Is that something that every breast cancer patient needs?
I think people who intrinsically have risk factors for heart disease, like hypertension, over the age of 65, have a history of heart disease, and are going to get chemotherapy drugs that interfere with heart function, definitely should go to a cardio-oncologist. But specifically, even very healthy people that are going to take cardiotoxic drugs should be referred from the get-go to a cardio-oncologist.
And we have Dr. Porter, who's the top of the top. We have Dr. Fabian, Dr. Jewell. You couldn't have been in better hands.
Yes,
you could
absolutely.
Not have been in better hands.
I agree 100%.
We already have some questions coming in, and I want to make sure our audience remembers this. If you have a question, you can send it to us 3 different ways: YouTube, Facebook, or the All Things Heart email. You will find different ways to connect with us, and the links are right there on your screen. We will answer your questions in real time. So while those questions come in, I want to ask Angela, when most people hear the word cancer, the word rest follows, maybe the word exhaustion, maybe you're just really down in the dumps, you're sad. Yeah. What prompted you then to start working out when you started cancer treatments?
As Dr. Porter, was saying, I just, at the time I didn't realize it, but looking back, I wanted to feel strong. I wanted to feel like that I had control over something, because your life you are no longer really in control of your life. You have, it's doctor appointments, and I thought I've got to do something so that I can feel stronger. And that's when I turned to the gym, and I am so thankful, that I did that, because I want to be able to help others, now in turn. So.
Is your phone going off because all your friends are texting you and saying they're watching you right now? That always happens. No. That's great. That's great. We love our viewers. Dr. Porter, can you explain what exactly is happening inside the body when someone exercises that protects the heart? Can you explain it in lay terms?
Well, there are a lot of things going on. And and the research is going further and further into depth. Now, I'll tell you one thing that may be new to people is that when you do exercise, your skeletal muscle cells send out little proteins called cytokines. And some cytokines, there's cytokine release syndrome when targeted therapies attack tumors, and those cytokines do different things. They send out signals to vasodilate, get fever, leaky lungs, but the skeletal muscle sends out friendly cytokines, and exercise doing treadmill, cardio, as it's called, gives out certain cytokines, and skeletal resistance exercise sends out other, they're called exerkines, cytokines from exercise. And these things go various parts of the body, including across the blood-brain barrier, and stimulate neurotransmitters in the brain. So when you say, and you don't necessarily have to get into a zone, it's not like you're setting a marathon, but your skeletal muscles talk to the rest of your body, and that's good news. These are friendly cytokines. You feel better, and other things get better. So that's one thing, and we know basically from studies dating back 30 years now that people who have higher energy workloads have less heart disease, and we can see that. And now we see with exercise in breast cancer population, women with Herceptin, that the people who are more physically active on self-reported activity have less decline in their cardiac function. It's small, but you can measure a difference in the people who were like Angela, who's just said, I'm doing this, and their heart function declines a little bit. It's not heart failure, but the measurements aren't quite as good, and they're better in people who have higher levels of exercise, and their quality of life is better, and some of their strength is better. So there's all sorts of benefits that you get, and now there's research on whether you do it better under supervised research or not, on your own or supervised exercise. And I think everybody, I was thinking back on this, if you want to know the difference between supervised exercise and not, think about people who went to the gym before COVID, then the gyms shut down, and so you're on your own. I do an hour of exercise several times a week in my gym. When it stopped, when the gym had to shut down, I could not make myself do more than 40 minutes of exercise over the entire lockdown, and I didn't do any abs or crunches. None of the stuff I hate did I do. So you cherry pick the easier stuff, you don't do as much, and that's what happens with unsupervised activity, unless you're a high motivation person. Such as who we're sitting with today.
Dr. Jewell, you've been nodding your head yes vigorously. This is something that you feel passionately about too.
It is. I mean, in all cancers, and is what we're seeing, patients do better when they stay active. I think a lot of people, especially seeing someone amazing like Angela and what she's done, I think some people can see that maybe being a mountain higher than what they feel like they can do. And a lot of what we talk about is, especially for me, I operate, and so I'll see patients after surgery, and I'm like, this isn't that you're going to do a whole extra mile today. Every activity you do, think about doing 10 extra steps, doing just a little bit more than what you did before, and over time you'll see that builds up.
Dr. Fabian, Angela underwent chemotherapy, radiation. She had a double mastectomy. That's a lot. It is. How big of an impact do you believe Angela's exercise program had on her recovery?
I think that the others have summed this up in terms of making her feel better, improving her whole body function, her cardiac toxicity. But there's a lot of research that indicates that exercise, because of the increased oxygenation to the tissues, which helps prevent cancers in the first place, is very protective and reduces relapse and probably improves overall survival, not just from heart disease, but also from cancer. There's some really interesting research that has to do with these little things that run around in your body called microRNAs. And some of these microRNAs actually cause resistance to chemotherapy. Others improve response to chemotherapy or radiation therapy. And others may protect or increase cardiotoxicity. And there's some emerging evidence that actually the type of exercise that Angela and Dr. Porter are talking about actually gives a favorable pattern to these microRNAs. And I think that you're going to see a lot more research about this in the future. But I don't think there is any question that exercise will improve her overall chance of dying or surviving from anything, as well as reducing her risk for recurrence for breast cancer.
You know, I just want to make sure that our audience is hearing this. I have 3 of the top doctors at the University of Kansas Health System, and they are all saying essentially that exercise creates medicine in your body that fights cancer and protects your heart. It truly is research, science-based. Angela, you competed in a bodybuilding competition 1 year after your reconstruction.
Yes.
And you won.
Yes, I did.
Which is incredible. Where did you find the energy or motivation to start training and getting in this kind of shape? I mean, look at the shape that Angela got herself into.
Yes. I think, 1 to 2 years. I honestly can't quite
But that doesn't
exactly
happen
remember.
overnight.
No.
You didn't just wait a year and sign up for the competition.
No, I didn't. Like I said, when I first was diagnosed, I just wanted to, start working out so that I could feel stronger. And then it just became a love. Like, I absolutely love going to the gym and I love working out. And I thought, you know what? I made it through cancer. I beat, stage 3 cancer. Why not?
Right.
Why not try for, a bodybuilding competition? I mean, I had no idea that I was going to win, but that was amazing. It was just, so I just wanted a goal for myself,
Tell us about your nonprofit. How will your nonprofit work?
So my nonprofit, it's based off of being able to, talk to cancer patients, that have been recently diagnosed, but then ones obvious that have also that are also in remission. And what I want to do with that foundation is I want to be able to teach those survivors and those going through cancer the importance of, what we are talking about, here today. Because I don't feel that a lot of people are aware of that. At this time, there is so much that your body goes through when you're going through chemotherapy. And I want to make sure that others know, that you need to go to the gym and that this is why, you have anything in my nonprofit. I want to be able to set those, people that are coming in to see me. I want to be able to set them up with, personal training that I do for them, in our own, private gym, because I want to make sure that it's still a healthy environment. There, but I also want to let them know, you can have hearing loss, as well. You can have dental problems as well. And I want to be able to provide them with resources. So working with medical doctors in the community, such as Dr. Porter and Dr. Jewell, and Dr. Fabian, and dietitians. That's my ultimate goal, is to be able to have them call our nonprofit and to be able to set them up on all that for, currently, but also in the future.
So someone gets that diagnosis, and then either Dr. Porter, Jewell, Fabian, one of the doctors says, hey, there's a nonprofit that can help you, and she'll get you started on a a program.
Yeah, absolutely.
That would be incredible. It's not up and running yet.
Not yet. We're in the process, of getting everything in place and going and finding a location for that. So it is. I just want to be able to give back. I feel that, God put, this in my path, for a reason. And He put all of these amazing doctors in my path. And I want to be able to say, you know what, this is why, this was put in my path, so that I can help others.
Can we share more pictures of your wedding?
Oh gosh, absolutely, please do.
This made me so happy. You got married at the Royal Spring Training Camp.
Yes.
The guy who performed your ceremony is?
Oh, he is Les Norman, a former Royals baseball player. Yes. So, and he is one of our best friends, and he is just absolutely amazing.
And Dr. Porter, you were so impressed by Angela that, is it true you're considering being on the board?
I volunteered for that.
Okay, of her nonprofit.
Yeah, well, because she's got so much energy to do this, and it's extraordinarily visionary, because she is very special, because she looks at her own disease and then fights through that, and then looks to help others, and that is extremely rare. to have an idea about that and carry forward with it. And I just, hats off.
To have you
to
on
that.
the board is such an incredible endorsement.
Yeah, but some people help on boards more than others, so I don't know whether I don't know whether I'll be a sail or an anchor weight, But
Dr. Porter, actually, when I went to visit him for a visit, it was a couple years ago, I just mentioned this to him, and I was like, here's my idea, this is what I want to do, and he really gave me that extra, push, that extra bump, saying, absolutely, this is what this is what you need to do. So, and I will help you with that. So.
We have some questions coming in from our viewers, so I want to start with our questions coming in. Yen Liang writes, we all know that cancer can spread to other organs. Cancer can metastasize. What I want to know is, with so much blood passing through the heart every day, why don't we often hear about cancer cells spreading to the heart? It's interesting.
That is.
Do you know?
I can give an answer.
Give us an
It'll
answer.
Sound like I know.
Okay, perfect. That's what we'll take it. We'll take it.
Part of three things that cancers do with their mutations that make them bad are it's uncontrolled cell growth. They just grow and get bigger and bigger. And they invade other tissue, and they spread. Prostate cancer tends to grow locally in older people and spread in younger people. The cancer cells are old. They say, I don't want to travel, I'll just stay here. But breast cancer cells do not tend to have mutations that tend to make them sticky in the heart. Okay. They'll go to bone, they'll go to brain, but the heart basically is just, you're going pretty fast through the heart. That blood's going fast, and it just doesn't stick. I don't know why, but there are primary tumors into the heart that are rare. They're mostly on the right side, sarcoma types. But and there will be tissue. There'll be spread of cancer into the pericardium, the outside lining of the heart. But it's very unusual. The characteristics of the cells that make them cancer don't have characteristics in general that stick in the heart as the blood's going through.
Vera McLeod has a question. Is bradycardia, is that how you say it?
Yes.
Is that considered heart disease?
No. Bradycardia bradycardia is a heart rate less than 60. Some drugs cause bradycardia. Taxanes, which are part of breast cancer treatment, are one, but it's not very common. And this is my own observations, amongst cancer patients, the heart tends to go faster. I see more breast cancer patients than any other type of patient who come in because they have an uncomfortably high heart rate. And there are drugs we can use, depends on what else is going on. But sometimes you just treat the tachycardia because it just doesn't feel good. Other times the tachycardia is because the heart is weaker. But bradycardia is relatively uncommon. And physical fitness also creates a higher vagal tone, a cranial nerve output that slows the heart down. So if someone tells me they're running 20 miles a week and their resting heart rate is 90, either something is really wrong or they don't know how long a mile is because they're not going, not going 20 miles in a week.
Jill has a great question, and this one is for Angela. She writes, I guess this is a question a lot of people have. Working out has so many different connotations. What does a workout for someone going through cancer look like, and how rigorous is it?
So I loved weight training. The cardio kind of wore me out a little bit more when I was going through that. So I had to, be mindful of that and only do about, 20 minutes or so of just, walking on the treadmill or the stepper. But the weight training is where I felt, I guess, the most benefit, I guess, for me, because I was feeling, I was able to feel stronger and get that way with the weight training. So, yeah, I would say, go through.
Jeremy has another question and a comment for you. Jeremy Yenser writes, I imagine that has got to be so exhausting. On those days where you just were wiped out, how did you find the motivation to get up and get active. And good job, by the way, you're killing it.
Aw.
That's from Jeremy.
Thank you, Jeremy. You know, the motivation, I don't know, I look back and I think, wow, how did I do that? But it's just the will to survive. You know, that's what it is. It's the will to survive, and to, you know, want, you know, to do everything that I possibly can, and to also, you know, go and tell the doctors, here's what I'm doing this and this and this, you know, can I be doing any more? You know, so I just, you know, yeah, I don't know, honestly, the answer to that question, but I just got it, and I just did it, and I am so thankful I did. Yes, exactly. It's the will, will to live. So.
And you had a lot to live for.
I sure did.
You're married with a new partner. That's amazing.
Yes, he is amazing.
This conversation could go on for another 3 hours. I just love all of you. It's time for some final thoughts from our guests. Angela, I do want to start with you. What's it like to see the doctors that saw you when you were at your worst, and here you are on a show with them? You've got Dr. Fabian speaking in glowing terms, Porter, Jewel. What's it like?
Oh, you're gonna make me cry. It's amazing. I mean, they are my doctors, and I have the best team that I could ever ask for here at KU. And not only are they my doctors, but they also became friends. And I can't thank you guys enough, because you are just part of my heart forever, and I could not be more grateful. So thank you for everything that you have done. And you know, when you're going through cancer and everything, you know, this, I never would have thought this, you know. So yeah, it's amazing. And to know that they're behind me, and that they're behind my nonprofit, you know, so.
Forever.
Yes, forever. Yeah, exactly. Exactly.
Dr. Fabian,
Yes.
what would be your message to our viewers or to Angela?
Well, Angela, thank you for the kind words. I work heavily in breast cancer prevention now. And what we know from long-term studies is that exercise is so important in reducing risk of getting breast cancer in the first place, particularly for people who have a family history of breast cancer, or who are found to have a genetic mutation that puts them at increased risk. So Angela, I really hope that in your nonprofit, you will also help to counsel women who are at increased risk for breast cancer but have not yet developed it, and hopefully never will.
Absolutely, right, absolutely, yes. Absolutely.
Dr. Jewel, you're nodding your head, yes?
Well, yes, agreed.
Feel
I do a lot of prevention stuff as well, and we have a lot of shared patients with genetic mutation populations with the breast doctors. You know, I would just like to highlight, you know, Angela was so motivated, and Angela also used the village and resources around her. And when you come to an amazing place like KU, we have dietitians and physical therapists and specialists in all of these fields, and we want you to use all that. We want to make you have the best chances and the best outcome possible. And so I just really want to highlight, you know, she did that, and she's still doing that, and I think that's why everything has gone so well for her as well.
She took advantage of every tool in the toolbox.
Yeah.
I did.
And really worked it.
Yep, absolutely.
Dr. Porter, what would be your final thoughts for our audience and for Angela?
Well, for Angela, you know, I just think it's actually puts a little more pressure on other patients, because Angela did all this, so other people say, oh, I'm too tired. It's going, oh, come on, you know.
Right.
Really.
Yeah.
You know, and exercise gives you energy. If I'm a financial planner and you're running out of money, I don't tell you to spend more money.
Right.
But when you're low on energy, you actually have to use more energy to have more energy. I mean, exercise gives you energy.
Yeah, absolutely.
And I find this, sometimes I'm telling myself, you know, on Saturday and I'm tired or something, I'm too tired to go to fitness class, but I know if I go through the fitness class, I'll have more energy an hour later than I did if I just sat home and thought, oh, I'm mopey, you know.
Right.
So it's good. And the other thing I'll tell the audience is resistance exercise has its own special benefits, but it's difficult unless, and I ask this a lot, whether people were in athletics in high school or college, because they have been trained. They know how to be fit, but resistance exercise is more challenging. You have to know the exercise, you have to know how much resistance, how many sets, how many reps per set, how long, how many sets, how much rest. So there's about 5 things that are complicated, and I've got weights I had in high school, but I never really used them much because I didn't know all those things. So get some professional help on that, because you can hurt yourself. Walking, you know, don't text while you're crossing the street. You know, you can pretty much walk safely with a few common sense things. But resistance exercise, and it does have a special benefit. So it's helpful. And don't worry about whether or not you gain muscle mass. Growth hormone, you don't bulk up as much. And as I tell people about exercise, don't worry about whether or not your muscles get bigger. At a certain point in life, the friends you make because you've got better muscles are probably not the friends you need.
Right.
You know, so just do something, do it for yourself, and you will be able to do more, and at least be able to walk 30 minutes, because if you go on a trip, being able to walk 30 minutes without stopping defines whether or not you're going to see the world from the edge of the parking lot, or actually from a more interesting part along the edge of the Grand Canyon.
Right.
And so there are benefits just in terms of being fit and seeking fitness, you know, and that's where the not-for-profit comes in, because she's going to help other people.
Right.
And I mean, how can you not? If Angela's trying to get you to do something, I mean, you're going to do it.
Right.
You know?
That's what Dr. Porter first said to me. He said, once you meet her, you're going to say yes to everything she wants you to do. And it's true. We love sharing the incredible work that our doctors do, how they save lives here at the health system. But have you ever wondered what your doctor does outside the hospital walls?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
We want to start with Dr. Fabian, because there's a good chance you will see her with her grandkids and great-grandkids at the Kansas City Zoo. When was this picture taken, Dr. Fabian?
About a week ago at Glow Wild.
And you love it there.
I love it there. I started taking kids to the zoo before I even had kids. It's a wonderful place, and it gets better every year.
Whose kids were you taking?
Oh, those were my grandkids. But no, I was taking my brother's kids before I even ever had kids.
You're a good aunt.
And they even have a heart-healthy black bean burger that is to die for.
I've had that. It's really good. We do have another picture we want to share. 2 very special people are in this picture. Dr. Fabian, who are those people with the goat?
The little one in the stroller is my great-grandson, and that is my granddaughter. And Mr. Goat and Liam were having a very special moment.
That's so sweet. That's your happy place. Now,
that is my happy place.
Dr. Porter, you've been talking a lot about exercise and how it lets you walk to the ends of the earth, and you've actually sent some recent pictures from the ends of the earth, because you are also a photographer. Where were these pictures taken?
That was taken in outside Chamonix in the mountains on what's called the Mer de Glace, or the Sea of Glass. It's a glacier you can access through a cogwheel train out of Chamonix. And there's a family, every year they tunnel through the glacier and make sculptures. They put in wiring, and so you go through here, and it's all just amazing. Those are that's my wife and the friends I was just traveling with into the Alps. So
you hiked Mont Blanc.
Yeah, I didn't go up to it, but I went around it, and that was enough.
That's incredible. We have all sorts of pictures and photographs that Dr. Porter takes. We will share more as you appear on more episodes of All Things Heart. And finally, Dr. Jewel. Dr. Jewel has a mini-me. Dr. Jewel, tell me about your mini-me.
Yeah, this is my daughter Gwen. I actually bring her up to the hospital sometimes when I have to work on the weekend if I have to get some stuff done. And
does she wear that?
She does. Yeah,
so
she has
cute.
matching scrubs with me and her own little stethoscope, and so she'll sit and do her own work while I get some stuff done. So.
Do you think she'll be an oncologist?
You know,
it's too early to tell.
I don't know. I'm in medicine, but my husband works in music, so she'll probably do something totally different.
Who were the other kiddos in the picture next to Gwen? there was a group shot of a bunch of
Oh,
little
is there
kids.
another one? Let me
Yeah, there
see.
you go. And it looks
Oh,
like
that's
there.
my son. That's
Okay,
my
your
son
son.
Bronson. That was for my birthday. They made me cupcakes.
Oh, that's
and that's us at
wonderful.
our lake house, which we always enjoy going and swimming and relaxing.
You
so.
deserve to relax. All doctors
absolutely.
deserve to
Yes,
have
they
some
do.
downtime. Thank you so much for
Yes,
being
they
with us
do.
today. Huge thanks to Angela and her doctors. Coming up next week on All Things Heart, we are celebrating American Heart Month, and we're going to have Dr. Porter back on for a deeper dive into cardio oncology. And you'll meet a woman in his care right now who has a message for every woman watching. That is next Thursday on All Things Heart.
Coming up tomorrow on the Morning Medical Update, Justin Reddycop signed up to save a life. And when his phone finally rang 10 years later, he never expected he would also need saving. I'm Jessica Lovell on the next Morning Medical Update. 2 lives, 2 battles connected by bone marrow. How a selfless donation became Justin's second chance. Friday at 8.